Hey, and welcome to the Narrative Mindset Podcast. I'm your host, GT, and thanks for tuning in. In this episode, I'll discuss the phenomenon of unwanted child filicide, the killing of a child by a parent or step-parent, specifically rooted in the rejection or perceived burden of the offspring. Represents one of the most tragic intersections of public health, criminology, and psychology. While filicide as a broader category encompasses various motivations, including severe mental illness, abuse, and retaliation, cases driven by unwanted status of the child possesses distinct epidemiological and sociological characteristics that require careful evidence-based examination. Criminological and psychological research consistently categorizes filicide to better understand its etiology. When categorized by motivation, neonaticide, the killing of a child within the first 24 hours of life, it frequently aligns with the phenomenon of the unwanted child. Epidemiological studies show that perpetrators of neonaticide are often young, unmarried, and socially isolated women who experience profound denial of pregnancy, unlike mothers who commit filicide later in life, who frequently suffer from severe postpartum psychosis or depression. Perpetrators of neonaticide often harbor a profound psychological detachment from the pregnancy, driven by intense fear of social stigma. Economic destitution or familial retribution. Beyond neonaticide, older children who become victims of unwanted filicide are typically subjected to fatal abuse or neglect. In these instances, the dynamic often involves situational stressors such as extreme poverty, lack of social support, domestic violence, and parental substance abuse. The child is frequently viewed not as an individual, but as a primary catalyst for the parent's trapped socioeconomic circumstances or relationship distress. Sociological data indicates that unwantedness in these older cohorts rarely manifests as a sudden premeditated act, but rather as an escalation of chronic neglect, mistreatment, and mounting frustration within dysfunctional domestic environments. Examining the risk factors associated with this form of filicide highlights critical areas for preventative intervention. Public health frameworks emphasize that social isolation is one of the most reliable predictors of neonaticide and fatal inherent neglect. When pregnant individuals lack a confidential, non-judgmental support network, the perceived catastrophic consequences of carrying an unwanted pregnancy to term can override maternal instinct. Consequently, public health initiatives have long advocated for robust, anonymized surrender protocols, commonly known as safe haven laws, which allow parents to relinquish infants safely without threat of criminal prosecution. The primary objective of these laws is to mitigate the desperation that leads to neonaticide by providing an immediate legal alternative. Furthermore, addressing the broader spectrum of unwanted child filicide requires systematic improvements in maternal and mental health care. Universal screening during prenatal visits for psychological distress, domestic abuse, and socioeconomic vulnerability allows healthcare providers to identify high-risk individuals before a crisis occurs. Access to comprehensive family planning, destigmatized abortion care, and subsidized child care also serve as vital structural deterrents, directly addressing the root causes of unwantedness and parental overload. Ultimately, unwanted child filicide is a multifaceted issue deeply intertwined with social safety nets, mental health literacy, and reproductive autonomy. By analyzing empirical data rather than relying solely on retributive narratives, society can better identify the precursors such as tragedies, shifting the focus toward early detection of parental distress, poverty mitigation, and the expansion of confidential support systems remains one of the most effective pathways toward prevention and the protection of vulnerable children. Thanks for tuning in to The Narrative Mindset. If you enjoyed this episode, leave a comment wherever you listen to your podcast, and don't forget to follow the show. It really helps the podcast grow. The Narrative Mindset is a show about how human stories form, twist, distort, and break. It covers the full spectrum of human psychology from everyday emotion to extreme behavior because all of it lives inside the narrative mind. Episodes like this fall within that spectrum. They examine the underlying mental disorders, distortions, and collapsed thought patterns that drive catastrophic decisions. This is not meant to glorify violence or excuse harm. It's meant to narrate and understand how a human mind can malfunction from my perspective and my mindset. If you're sensitive to topics involving mental illness, trauma, and crimes against children, please listen with caution. This content is for educational reflection and psychological insight, not shock